We don't look at this as government intrusion. We look at this as empowering child care providers to be a huge influence in children's healthy eating habits and nutrition and physical activity. We also have done trainings and done lots of work with child care providers who actually are wanting this. We did a Let's Move child care training of last year, and we had a child care provider that came up to us afterwards and said that she's been in child care for over 30 years, has taken every training under the book, and she said to us, I think that this is the best training I've ever had, and I think that it should be required for all child care providers to take this type of training prior to getting their license. They want this information, they're hungry for it. A lot of them just don't know how to incorporate these initiatives into their program, and so by doing this, it's empowering them as opposed to mandating it.
Having healthy policies included in childcare is just one way to address childhood obesity. Idaho has about 30% of children who are overweight and obese, and one of the easiest ways to change children's behaviors is to start as early as we can in these settings where children are spending the vast majority of their day. So there's definitely a need. And in terms of Idaho childcare, Idaho actually ranks 51st in the nation in terms of healthy policies for childcare to include physical activity during the day in the childcare setting or healthy foods. So we feel like working with Boise at the local level and trying to get these policies incorporated into the city's licensing will really do a good job in trying to set a standard for hopefully statewide providers to incorporate more activity, better foods, limiting screen time, and supporting breastfeeding mothers in the child care area to help curb that childhood obesity and set those healthy habits for kids starting at an early age.
What about the smaller organizations, the smaller operations, that maybe charge a little bit less to clients? Is this going to be burdensome for them?
I don't think it's going to be burdensome for them as long as they have the tools and resources they know how to figure out how to do this. What we are asking or what we are proposing, it's not something that is a lot more work. It's more just providing those opportunities. For instance, the physical activities. It's not about adding physical activity to their program. It's about how to incorporate physical activity into their daily program anyway.